23-year-old woman has just been admitted to the hospital complaining of severe lower abdominal pain with vomiting and some nausea. The woman was at work when she collapsed. A co-worker witnessed what happened and rushed the woman into the ER. The woman had ignored her lower abdominal pain previously because she thought it was merely just menstrual cramps. She believed with time they would go away. The following events show the patient's stay at the hospital while also highlighting the aspects of the nurse-client relationship.
Here, the nurse assistant is setting up the room, creating a serene physical and psychological environment. She cleans the room by making the bed, putting up the side rail, moving the bedside table closer to the patient, placing a box of tissues on the table, and preparing a welcome bucket to put at the patient's side table.
Hi, Miss Karen? My name's Allison, and I'm going to be taking care of you today.
I can't hear you.
You can't hear me?
No.
Okay. Hi, Miss Karen. My name is Allison, and I'm going to be taking care of you today.
I have hearing
I gotta go get a different nurse. This patient can't hear anything I'm saying. I have to, yell to her. It's ridiculous. What are you looking at?
You can't talk about this in the hallway. Just her.
Whatever. I can't deal with this.
Oh, okay. Hi, Miss Karen. My name is Megan, and I'm going to be your nurse today.
What was that all about? Are all the other nurses in the hospital like that?
No. This nurse has been having some personal issues at home lately, but I'm going to take over from here, and we're going to make this process as smooth as possible.
Okay.
So, I see on your chart here that you have a history of hearing impairment. Can you understand me right now?
Yeah, if you speak slower.
Okay?
Yeah, it's better if you face her and speak more clearly.
Okay. So, we're going to do that. Now, right now we're going to need to take some vitals, so your blood pressure, and the doctor has also ordered for some blood work to be taken for your abdominal pain. Do you understand everything?
Yes.
Okay, so I'm going to be closer to you right now, so if you at any time feel uncomfortable, just let me know and we can take a break.
All right.
Okay.
The nurse begins the relationship by reviewing the patient's chart. The nurse enters the room and introduces herself. She fails to use eye contact and touch with the patient and does not engage a positive relationship. A new nurse enters the room and apologizes for the previous nurse's actions. This nurse noticed on the patient's chart that she has a hearing impairment and asked the patient which form of communication she would be most comfortable with.
Hi again, how are you feeling?
Better.
Okay, good. Like I said before, the doctor wanted to draw some blood to figure out what exactly is going on. So I'm going to go run back out and grab the stuff I need to get your blood, and then I'm going to take it and we'll send it down to a lab, and then the doctor and I will come back in a few minutes and let you know what's going on.
Okay.
Okay, I'll be right back.
Okay.
Hi, Mrs. Cam. How are you doing today?
Good.
My name is Dr. Stevens, and I came to talk to you about your blood work.
Okay.
I noticed that you had a very high white blood cell count, which indicates a sign of an infection.
Oh.
You came to the hospital today for abdominal pain, is that correct?
Yes.
Can you tell me more about that?
It's right here in my tummy, kind of on the right side.
On the right side, okay. I'm going to feel around on your abdomen and see if I can notice any abnormalities.
Okay.
Let me know if anything hurts, okay?
Right
to
there
hurt?
hurts, yes. Right there.
Okay. This is what we're going to do. We're going to have an ultrasound done to see, because I'm suspecting that you have an inflamed appendix, also known as appendicitis.
Okay.
So we're going to have an ultrasound done to confirm that.
Okay.
Okay?
All right.
All right. Megan's going to take care of you, and I'll be back in a little bit.
Okay.
Okay?
All right.
Get better.
All right.
All right, so like she said, we're going to get an ultrasound, so I'm going to take you downstairs, and they're just going to do a quick little ultrasound, no big deal, and then we'll bring you back up here, and the doctor will come back in to confirm.
Okay.
All right, I'll be back.
Okay.
Hi, Mrs. Karam. How are you?
Good.
We got the results of your ultrasound back, and it confirmed that you have an inflamed appendix.
Okay.
So we scheduled surgery around 4 o'clock to have your appendix removed. You're going to be fully sedated, so you won't feel anything. Okay? Do you have any other questions for me?
I don't think so.
Okay, all I need for you to do now is sign a consent form for us to go ahead and perform the surgery. All right. Thank you very much. I'll be back in after surgery to check on you, make sure everything went okay. If you need anything in the meantime, just let Megan know, and she'll page me, okay?
Okay.
All right, take care.
All right, so now that you heard what the doctor says, do you have any additional questions or concerns?
I'm just a little nervous because I don't know like what my appendix is, and I'm kind of nervous for the surgery.
Okay, well, we have a little sheet here. This is where your appendix is located. And they're just going to do a little incision right here, remove the appendix, and then close you back up. You'll have some stitches, but this is a common surgery, so you don't have to worry.
Okay.
It won't take too long, and they're going to have someone come in and prep you, and we'll be back after the surgery.
Okay. I feel a little bit better now that you said that.
Okay, do you need anything else before I leave?
No, I feel better.
All right, I'll be back later. Good luck.
Thanks.
Hi, Mrs. Cam. How are you doing?
Better.
Better? You feeling okay?
Yeah.
All right, well, the surgery was a success.
Okay.
Everything went good. I just want to check your stitches real quick and make sure everything's okay.
Okay.
Okay, everything looks good. So if you need anything from now on, just let Megan know and she'll page me.
Okay.
But other than that, take care and get better soon.
Okay.
The working phase begins when the nurse and patient team up together as partners to address the specific health care issues. The nurse clearly explains what tests need to be done. During this phase, the nurse and client have evaluated all possible alternatives. After the patient returns from surgery, they develop realistic goals for the future.
Hi, Mrs. Karam. It's been a day since your surgery, so I have a little handy pain chart. And can you point and tell me how much pain you're in? All right, well, as the days go on, this is going to slowly decrease as you start to heal. I have these discharge papers for you. Basically, it just explains what you're going to be going through the next couple weeks and such. I just want to let you know the key things. Make sure to keep your stitches clean, and if you feel cough coming on, you should hold your stomach so the stitches don't rip.
Okay.
It's been a pleasure caring for you, and I hope you feel better.
Thank you so much.
You're welcome.
The termination phase shows the nurse and client formally ending their relationship. The nurse explains to the client how the recovery process will go once she is discharged. At the end of the relationship, both the nurse and client feel satisfied with the goals accomplished. The bridges and barriers in a nurse-client relationship contribute to the healthcare process as a whole. The first nurse displayed a lack of caring by not making eye contact with the patient. She violated confidentiality when she loudly talked about the patient's medical record in front of non-healthcare professionals. The good nurse established trust by active listening, using positive nonverbal cues, and communicating with the patient in a way she was comfortable. She displayed mutuality when they made the goals together and were always on the same page throughout the healthcare process. Nonverbal cues. The nurse uses direct eye contact, shakes the client's hand, and uses a caring touch to establish trust. Verbal cues. The nurse speaks slowly and clearly to the patient. She also doesn't use slang or medical jargon. Throughout the relationship between the patient and the nurse, Swanson's theory on care was evident. The nurse demonstrated the 5 processes of caring. She strived to understand the patient's hearing impairment. She maintained emotional availability by not burdening the client. The nurse did for the client as she would do for herself. The nurse facilitated the patient's passage into and out of surgery by always explaining the procedures carefully. Finally, the nurse sustained the client's faith by always going the distance to help offer realistic optimism throughout the healthcare process.